Well, I'm joined now by Goodbye Malaria CEO, Sherwin Charles, and Neil Robinson, CEO of the company that made the bracelets, that's Relate. Gentlemen, good morning and thank you very much for your time. And I did receive one of the bracelets here. What I loved about this, and I've got it here in the studio with me, and I'm wearing this one with a yellow strip. I love the fact that it was personalized. I mean, I wonder if everybody else is getting this kind of personalized. Dear Dan, thank you for supporting the fight against malaria and job creation in South Africa. Handmade by Zuki. Please thank Zuki for me there in Khayelitsha. Neil, what made you to come up with this idea in support of the fight against malaria in Southern Africa?
Morning, Dan. Thanks for having me. Listen, it wasn't my idea originally. It was Lauren Gillis who started the business. And I think everyone remembers the Lance Armstrong Live Strong yellow band that everyone wore around the world. And Lauren came up with the idea of, you know, what if we could create jobs using a simple tool of a bracelet? And I think in 2008, Nando's turned 21, and Robbie Rosen, the founder of Nando's back then, and Sherwin, I know, was working for Nando's, came up with the idea of producing a bracelet and then feeding hungry children in the name of Nando's for a year. And that's where it all started. And Nando's became very involved in malaria work over the years. And, you know, it's such a simple tool, and it creates so many earning opportunities for people that don't have much in the townships, that live in poverty. And it's been a wonderful project. In the last 10 years, yes, we've raised close to 20 million rand, and it's been a wonderful journey.
Yeah, and it's a journey that has created some jobs in Khayelitsha. Those gogos and tatas there helping, who are making these beautiful, simple bracelets. I'm wearing one in the studio, the one that you sent me, guys, here. I mean, something so small, but has made a significant impact, Sherwin.
Yeah, absolutely, Dan. It's been a very special relationship between Goodbye Malaria, Nando's, and Relate. It's raised an amazing amount of money, and the bracelet really reminds everybody what cause they're supporting when you wake up in the morning. My bracelets, and I'm not sure if you can see them, have been with me for 11 years. And every morning when I wake up and you're in the shower, it reminds you that you got to eliminate malaria, that malaria can't exist on the continent anymore, and we can't have our young children dying from this dreadful bite from a mosquito.
You're saying it's been going for 11 years, and is that still underway currently, this campaign?
Yes, absolutely. Our relationship continues. The bracelets are for sale online at shop.goodbyemalaria.com, as well as at Relate. It's sold at our carts at the airports, as well as within the Tourvest stores. So it continues. Every year we get in excess of 1.2, 1.3 million rand towards the malaria campaign.
Now, for you, Neil, what has worked well as Relate? I mean, you stand on your own as a not-for-profit, and you are in partnership with Goodbye Malaria. Because for me, there's like a number of beautiful touch points here in the story of raising funds for the very important cause of fighting malaria, which kills hundreds of thousands of Africans every single year.
Yeah, listen, it's a wonderful story, and I think Francois Pienaar, the ex-rugby captain, said it beautifully when he said it's a virtuous cycle from the Gogos through to supporting their AIDS orphan grandchildren, through to creating jobs for them, through to supporting other charities and causes around the world. I mean, Relate works very well with malaria and Goodbye Malaria and the Global Fund, but we also do a lot of other charitable causes around the world. And, you know, we support in the health industry or the health sector, the women's upliftment sector, human trafficking, children's upliftment, literacy, you know, you name it, we pretty much cover the bases. And I think what's important for me is the elderly seniors in the townships who work in the Kamalabantu seniors clubs, who we partner with, get a tremendous kick out of doing something which helps someone else. And the dignity of having a job and the pride of having a job, I think is very important in South Africa. You know, yes, a lot of people have gone very hungry and are starving over this sort of COVID period. But I think we are of the belief that give people a job, let them feed themselves, and let them take care of others. That brings, for me, more of an upliftment story than just handing out food parcels all the time. So I think it's a great story all round, from the people in the townships right to the charities we support, as well as the various media partners like yourselves who carry our message. It's all a collaboration at the end of the day.
And it's not stopping now.
Definitely not. I mean, the disease burden in Africa is massive, as Sherwin says, and there are many, many, many more issues that we face around this continent and the world. COVID's a real thing, but there are many other diseases. I mean, I heard a stat the other day: 5.5 million people have died from cancer already this year. So there are lots of other issues that we need to deal beyond COVID.
The sad thing is that malaria is both preventable and treatable. Yet we know that every child dies every 2 minutes. A child dies every 2 minutes in sub-Saharan Africa. From what you've told us before, Sherwin, when we've had engagements, and recently we spoke about the challenge you're facing now, as most of the world's resources have been redirected to the fight against COVID-19, rightly so, that we shouldn't forget that we need still resources to fight against malaria.
Absolutely, Dan. We could have more people passing from malaria this year than from COVID if malaria left unprotected and people are not treated, and the medications through the supply chains that are challenged are not delivered on time. So certainly from our side, we're ensuring that the malaria programs within Southern Africa continue as planned to ensure that people are protected from malaria. Like you rightly said, it's absolutely curable, it's absolutely treatable, and more so, one can protect oneself from malaria. And I think it's a big message to your listeners right now, is to say to them, we're coming into summer, we're coming into the summer rains, mosquito populations are going to increase, we're going to be traveling locally, and please ensure that you protect yourselves from the bite of a mosquito, whether it's using just insect repellent or ensuring that there's a bed net in an endemic area. But please protect yourselves during the rainy season. We're coming into the big malaria transmission season right now.
Okay, Sherwin and Neil, but before I let you go, one of you gentlemen can just tell our viewers, in case they want to support this, because when you buy this bracelet, as I said, I'm wearing one of them, you buy this bracelet, you are helping to save lives. You are also supporting township pensioners in Khayelitsha. We are also helping to upskill young adults, those crafters, and you are supporting that entrepreneurial spirit. So how do people support you, for example, in this simple way of making sure that every bead counts?
Sherwin, keep your dogs quiet. You can go to the relate.org.za website, or you can go to the Goodbye Malaria website. And obviously, Tourvest is a large corporate who supports us through the sales and duty free at the airports and the Kruger National Park, etc. But they've got stores at the waterfront, and Goodbye Malaria actually has carts at the airports as well, all over South Africa. So when people start traveling again, that would be fantastic.
Okay, so
every bracelet counts.
It's the website relate.co.za. It's the goodbyemalaria.co.za, Sherwin?
It's shop.goodbyemalaria.com.
Thank you very much, gentlemen. That's Neil and Sherwin. Sherwin heads up Goodbye Malaria, and Neil heads up Relate. Both of them not-for-profit organizations that have teamed up over the last few years, and that's an ongoing partnership in the fight against malaria. And in that effort, they've also created jobs and helped a lot of disadvantaged people in Khayelitsha Township in Cape Town.